Welcome to an episode of Vidhi, Footprints and Sands of Time. This is a tale of survivors and achievers.
Hello, everybody. Welcome to another exciting episode of Vidhi, the Footprints on the Sands of Time. Today, we have a very celebrated maxillofacial surgeon, senior professor from Japan, who's come to India to spend time with us through SASOMI, which is South Asian Society of Oral and Maxillofacial Implantology. We are very glad and honored to have you, Dr. Tetsu Takahashi. Thank you very much for joining us, sir.
Thank you very much for inviting me to the Sassoon meeting. Here at London.
Okay.
Yes,
Thank you so much.
We are delighted to have you, sir. And Vidhi is all about giving inspiration and giving hope to a lot of people, a lot of youngsters, young maxillofacial surgeons. So we want to know what was your journey and how did you choose to become a maxillofacial surgeon?
Actually, my father was a double doctor. Doctor means medical doctor and the dental
Okay.
doctor.
Oh, okay.
I think a lot of influence I got from father. But first I wanted to be a dentist because at that time dentist seems to be very rich
Right.
and not so not so harder than medical doctor.
Ah.
So my motivation to get into the dental school is very simple. And just more rich, become rich, and more easy. But after I get into the dental school, I was so much interested in maxillofacial surgery as well as the oral pathology.
Right.
So I think that is one of my the desire or the one of my motivation to become a maxillofacial surgeon. So after that graduate from the dental school, I soon got into the postgraduate course. My mission was I was so interested in the mechanism of the diseases.
Right.
I always not only the taking care of the patient, but also want to know what is the etiology, what is the mechanism of the diseases. That's so I spent 2 years in microbiology and learned a lot about immunology.
Oh, wonderful.
So I got a PhD at immunology.
Excellent.
Yes.
Excellent.
But I also interested in the maxillofacial surgery, of course, especially the bone surgery.
Right.
To begin with, I was interested in the oral pathology and oncology. But after I spent some time in the United States and London. I spent 3 years in the postgraduate course, and after the postgraduate course, so that is nothing to do with the clinics,
Okay.
but also that was in research. I was so involved in the inflammatory process as well as the immune process.
Right.
Yes. But I came back. I spent so many years in foreign country. I was behind in the clinical job. So to become an oncology or the specialist of the oncology, as is always the case with other countries, it takes a long time.
Absolutely.
So I thought maybe I change my the position, the direction, and then I am interested more in the bone surgery, especially the orthodontic surgery.
Oh, wonderful.
And TMJ.
That transforms life, isn't it? Orthodontic surgery is a specialty
Yes.
which just can transform somebody because we do so much about the aesthetics of the face, the
Yes.
maxillomandibular
Relationship.
repositioning, and just the general life of the patient itself gets transformed
Yes.
with that.
But I'm not so well. Of course, the aesthetic surgery is very important, but function is more important.
Right.
So my direction, it's my lifetime work, is to join the TMJ as well as orthopedic surgery and reconstruction. I always keep an eye on the TMJ function because it's a very important factor.
True.
So my job is to seek the pathophysiology of TMJ function, and my research was involved in the synovial fluid analysis of the cell synthesis and the TMJ arthroscopy. But yes, to do so, I was so because I spent many time in immunology and microbiology. It's easy for me to do the research.
Research, absolutely.
So-
How was the training in Japan?
Okay.
From dentistry to maxillofacial surgery, especially about research. How do we go about it?
We usually to do the research. We in the undergraduate we have in my school half year just get into the very basic research.
Okay.
That is my first, the touch of the basic science. But after the postgraduate course, we have to learn more about the basic science as well.
All right.
And the thesis should be, the good journal
Right.
to have the impact factor also. So with the clinical training, we have to do the basic research.
Sciences
training,
as well.
sciences as well.
Right. Right.
And to become a specialty in Japan, usually at least 6 years of the clinical work and 200 cases of the major surgeries. And specialty means the on-site exam. On-site exam is somebody examiner comes and see my
Work being done?
Yes, yes. So it's interesting.
Right.
It's one of the most difficult part to become a specialist.
Right.
So at the time I was so involved in both the research and
Clinical
clinical
aspect.
aspect. So I spent several years in the basic as well as the clinicals. Then I continue my work, especially for the direction for the TMJ and also the surgery and the bony reconstruction.
Wonderful.
And then that specialist. Yes, that's my history.
Just a while back, we were at the Bowring and the Lady Curtin hospitals looking at some of the post-resection mucormycosis patients.
Yes.
And you also told me then that you did a lot of cleft surgeries
Yes,
and
yes, yes.
craniofacial surgeries
Yes.
in countries you had to travel. So what is your opinion on collaborating the best minds coming together? Something like a SASOMI or any other association as such. What are
Yes.
your views on that?
I am very. Today I was so impressed by the mucormycosis and happening in this Bangalore, the special hospital. I saw many cases, and I have never experienced the mucormycosis, especially in this region. So it's very new to me. I was so amazed because this team was well organized, and after the resection of the muscle, then they collaborate with the prosthodontist and the microvascular surgery as well, and then dental implants as well.
Yes.
So I think it's a very. I saw a lot of cases and very well organized and very good results as well. But in Japan, with some reason, I would like to know the reason, but so different because we don't see any patient.
Anything at all?
But today's the dean of that school just told us that we don't know yet the exact why the mucormycosis happens in the maxillary regions. And maybe we can we can share the experience and we can share the patient data and then the analyze and then maybe the next step is to seek pathogenesis or the mechanism or the etiology of the
Disease
diseases.
process. Yeah.
I like that style because my style is to seek the pathology first and then translate into the clinics.
Surgery. Yeah.
Yes, yes.
Absolutely.
And I think it's very important. We should feedback. And then we should continue to seek the why the patient have become such a the mucormycosis, and then we should know, and then we should know the process. Then that is very helpful for the either both surgeons and also the patients. I think it's a very important process.
Absolutely.
So I think it's Sasomi and then now the Japanese Association, counterpart the Japanese Maxillofacial implants.
Association. Yes.
Yes, collaborate, and we're going to talk later. But I think it's good to have such the common
Vision.
project. Yes, for the future. I think it's the benchmark, and I think it's a very important collaboration
Absolutely.
between Japan and India.
India.
We have a lot of patients. We don't have the patient, but we have a lot of resources as well. Resources means basic sciences as well as the research.
Research. Yeah.
Yes, yes.
Absolutely.
So-
Research is something which we really want to,
Step up
endorse more, step
Yes.
up more, and go in more detail in.
Yes,
Right.
we should we should know more about the diseases, and then we should know about the patients, and then the research deepens the knowledge and
The understanding.
Yeah, understanding. That helps the treatment of the patient. I always that is my the lifelong style on my style for a maxillofacial surgery. Not only the clinical job, but also basic research.
Basic research. Yeah.
So tomorrow I will do the presentation, but my presentation is very the basic focused research. But
Right.
not only the basics, but the translation is very important.
Right.
That process is that's my job.
We have so much to learn from you. But surgery is, and surgery and research is a whole part of your life.
Yes.
So much of your life is dedicated to research and surgery. But we want to know what are other passions of your life.
What
What
keeps
do
you
you like?
going?
Well, it's a good question. I don't know. But I have been involved in the international, the job. I mean, I have been like I'm a foreign minister of the Japanese Association always
Oh, okay.
because my experience in 2 years in the United States and 1 year in London. So as a Japanese, my English is a little bit good
Right.
compared to the standard Japanese. So that's why I have been involved in international affairs for a long time. But it's my great pleasure to see the many doctors and also the patients that come, and then that makes more for me more energetic, and that means another motivation to seek the new
More things. Yeah.
So today I was so amazed as well, and then I'm not so young, but I'm still.
Oh,
Yeah.
sir, absolutely. I think we are young you're young at heart, and there's so much more that you can contribute to science.
I always, I always talk to the young doctors. We open the door, then you see the next door.
Oh,
So always the wondering, we see the next door. So we see the next door.
oh, that's
Sure.
wonderful. That's
Such
such
a beautiful message to any
Wow,
young
yes.
young student who wants to be a doctor, wanna be surgeon. It's the best thing that he can take away from your talk today.
Yes, and I always see, I always talk to the young doctors. let's go to the foreign country because we learn every time I go to the foreign country, I learn something from the doctors and from the other people and the cultures. So that it is always my motivation. So that's why I continue my job and then continue my journey. That is my job.
Wonderful. What legacy would you like to leave behind for all the younger generation of surgeons who look up to you and get inspired by you, your work, your
yes.
research? Because
Okay.
our theme is the footprints on the sands of time. Your footprints will be an inspiration to a lot more who's going to come. So,
Okay.
what legacy would you like to leave?
Yes, that is a good question, and my maybe that is where maxillofacial surgery is not only the science, not only the art. So science and art is very important. So both we need the skills and the minds, and both is important. Both are important. So science and art. Yes.
Wonderful.
And I always encourage the young doctors, and we seek both
Absolutely.
skills and the minds and the arts. I love arts, not only the architecture. I played the saxophone and violin.
Oh, really?
Yes.
Oh, wonderful. We
And
would like to
sax-
have a short concert when you come
Where
next time.
I always play the saxophone in international conferences.
Oh, wonderful.
Yes, maybe next time.
Definitely.
Bring my saxophone.
Would love to
Yes.
listen to it. We are all lovers of music, and I'm sure all our audiences are, so we would love to
Yes.
have that rendition.
We are elated and we are thrilled to bits to have you with us and have your words of wisdom shared to all our audiences. So thank you for doing this for us. We would like you to see more of you in India. And of
Yes.
course, if some of our audiences and some of the young maxillofacial surgeons are interested to work and learn and train under you, I'm sure you'll get a lot of mails
Yes.
from them.
We would like to learn from you too,
Yes,
and
thank you
maybe
very
come to
much.
Japan, have a collaboration like how you come to India. We have so
Sure.
much to learn from you, and especially the fields in orthodontic surgery and TMJ. There's so much to be learned. There's so much to be known, and we are really inspired by the fact that you said there's a door, you open it, and you see the next door.
Yes.
And
Always.
research for us is something
Always.
like that. So we
Yes,
would
yes.
continue to keep seeking, continue to keep learning,
Yes.
and thank you so much for doing this.
Thank
with
you.
us.
Thank
From
you
the
so
team
much.
of Mukha and the team of Vidhi.
Yes.
Vidhi means destiny.
Yes.
Vidhi means hope. Vidhi means a lot of positivity. We
Yes.
thank you for doing this for us.
Thank you.
And we wish you a great time in India. And we hope to see you soon again.
Thank you.
Thank you,
Thank you, Sai, and thank you,
Gauri,
Gauri. Thank you very much.
Thank you, sir.
Thank you.
all.
thank you from us. Vidhi, the footprints on the sands of time. Thank you.
Vidhi, the podcast is dedicated to tales of healing and facilitators of health and well-being. This is a Mukha facial surgery initiative produced and brought to you by Dr. Girish Rao and Mrs. Sujatha Girish. Podcast is hosted by Dr. Sri Gauri and Dr. Sai Swaroop. Thank you for listening.